Hi, I'm Bridget, Clinical Services Director at Animor, and I'm here to answer any of your Ask Animor questions. So, we have had a few questions come in today on our emails and our feed. So if we don't get anyone, I will start reading those out. So, number one, I did have a question about what the best age to neuter cats was. Obviously, someone has said, I have two kittens, a male and female, and I really would not like any more kittens. When should I have my cats neutered? This is a great question. Often people think that siblings won't have babies. Unfortunately, this is not the case in the cat world. And as we get into spring, where the daylight hours are increasing, our female cats will start to come into season and be fertile. Young females can be fertile from about 4.5 months of age. So what we recommend is booking cats in any time from that age, so 4 to 5 months of age, to get them neutered. One of the prerequisites that we usually like to ask for is that the cats weigh 2 kilograms or more, and often we'll find that the male cats are slightly larger and grow slightly more quickly. So it makes sense in these cases to get the boy cat done first. It is also a slightly shorter, simpler procedure for male cats. And then once he's recovered and the female reaches 2 kilograms, we can get her neutered as well. But we will do early neutering, and this is something that the cat's protection has shown doesn't have any adverse effects and seriously helps with population control in cats. Right, I've got a few questions here. So from Paige, she says, hi Bridget, my cat never seems to drink water ever. Is that normal? Thanks for that, Paige. So yes, cats are incredible. They're a bit like desert creatures. So they're quite directly descended from African wildcats and are very, very good at concentrating their urine. So they don't need to drink an awful lot. One of the things that cats are very finicky about, one of the many, many things for all those cat owners, is they have quite specific requirements about how they like their water and their food stations to be set up. And often people aren't aware of this. Cats prefer to drink from either running water. So often cats will drink from a bath tap or a dripping kitchen tap, and not the lovely bowl that you put there. Many people have cat water fountains that mimic this. And the other thing that cats do like to drink from is wide, shallow, clear glass containers. So something like a glass bowl or perspex container. And this actually mirrors a stream or a drinking hole where an African wild cat would usually drink. Cats do not like to have their food and their water anywhere near each other. Preferably, they need to be in separate rooms, which is a bit counterintuitive. And unlike dogs, it does mean that all those lovely cat bowls, which have the water and food compartment, aren't ideal. The reason for this is people think that in wild African cats, where our cats are directly descended from, they're relatively small predators. So if they took their kill to the water hole, it would either contaminate the water hole or be stolen off them. So your cat is probably drinking, but he's probably drinking from a wide, shallow, muddy puddle outside, rather than the lovely water bowl you've got for him. I would suggest it is a good idea to try and increase water intake in cats because it helps to prevent them getting lower urinary tract problems, bladder disease. So if you can get a water fountain or try some of the other tricks to increase their water intake, that would be a good idea. Final thing to say is if you do feed your cat tinned food or moist food, a huge proportion of that is actually water, so they may be getting most of their water requirements from their food. Hope that answers that question for you, Paige. So Chantel has said, hi Bridget, we have a lab who is on a diet, but we miss giving her treats. Our friend suggested carrots, but she's not keen. Is there anything else we can give her? Oh, Chantel, you're a woman after my own heart. So I have a Labrador. It's a constant struggle for them not to be overweight. I think that the key thing is giving a treat. Part of that is the social interaction and the reward that a dog experiences. If your dog has food that she particularly likes, like kibble, and if she is a very food motivated dog, taking a few pieces of kibble out of her daily allowance and actually feeding her those would be a really good idea. I'm not sure what weight loss diet she's on. They're very good calorie reduced treats that are actually formulated by some of the manufacturers who make weight specific diets. Hill's Metabolic is one, and the equivalent is if we give them one biscuit, it's like us eating an apple when we're on a diet as our snack, rather than a chocolate bar, which would be the equivalent of one of your usual everyday pet shop or supermarket treats. The other things that do work, I often recommend carrots. My lab loves them, but you can try other things like bits of celery, which are slightly crunchy. Vegetables are quite good. You can try things like some broccoli or cauliflower. Some dogs do like the crunchy texture. Steer clear of fatty human foods, so things like cheese and ham and all of those things, because you're undoing all the good work that you've done. I hope that is helpful. Right, next we have Sharon, who has asked, our 7-month-old Cocker Spaniel is humping family members' legs, in particular my husband. Should I make an appointment to get him castrated to stop this behavior? Right, again, Sharon, fantastic question. So this is something we commonly get asked, and I think what's happening with your young man is he is going through puberty. He's getting lots of hormones flooding his body, and anyone who has young children heading into their teens knows exactly what that's like to live with. Humping is a fairly natural behavior. Some females will hump as well, and it's often an expression of excitement. So you might find that this happens when he's about to go for a walk, or if someone comes into the door and he gets very excited to see them. Whilst it seems natural to go, yes, let's castrate him, that'll solve all the problems, unfortunately, this is not always the correct thing to do and something that will just fix an issue. With male dogs, we have to look very carefully at the pros and cons when we're considering whether we surgically castrate them. So with females, there is a lot of good evidence to show that we prevent some very serious health issues if we neuter them. Whereas with males, the balance is about 50-50. So we do get a reduction in certain conditions. So dogs who are castrated when they are older are less likely to have an enlarged prostate. They're less likely to have hernias around their bottom and tumors around their perineal region, so around their underneath of their tail, around their anus, those areas. And also castrated dogs can't get testicular cancer. The flip of that is there are some tumors which have a slightly increased risk if we neuter our dogs. So it is a very small risk, but it does increase the risk of certain lymphomas, splenic tumors and bone tumors. So what we need to do is look at these individuals and say, are they a breed that are at particular risk of any of these cancers? Because some dogs like German Shepherds or Rottweilers, for example, or Labradors would have an increased risk. So we'd have to weigh that up very carefully. I think ultimately at 7 months old, I wouldn't advise castrating any dogs. I like them to be skeletally mature. So this means that all their bones have fully grown and developed. and they don't need their growth hormones and their sex hormones for any more growth. And this usually happens around the 12-month mark. So smaller breed dogs, it can be slightly younger, but I don't like castrating dogs prior to this. Ultimately, I think with castration, we need to meet the dog, have a chat to you, and have a look and see, because often people think castration will solve all behavioral problems, and this really isn't the case. Sometimes castration can make some behavioral problems worse. If we have very nervous dogs who are approaching other dogs or humans by putting up their hackles and being slightly trying to show that they're a bit braver, if we remove their testosterone, we actually might make that behavior worse. So speak to your vet is always a really good idea. In the meantime, if the behavior is becoming very difficult to tolerate, we are fortunate in that we have a very nice alternative, which is a chemical castration implant. And this can often tide us over problem periods like puberty if it's becoming very difficult to deal with the constant humping. The implant is called a supralorin implant and doesn't need to be given under anesthesia. I love this, and I've used it in my own dog. It's kind of like a try before you buy castration, because once we do the surgical procedure, there is no reversing it. So I'm a great fan of this. And if you're really finding your dog's behavior problematic, have a chat to your vet and ask them if the supralorin implant, there is a 6-month or a 12-month variety available, would be an option for him. Thanks. Let's have a look and see if I've got, we've got my year-old Cocker Spaniel is currently on season. How long after this finishes can I get her spayed? Again, fantastic question. So when we spay female dogs, we usually like them to have a first season, same reason as male dogs, so that they're fully grown and developed before we spay them. Now, safest time to spay them, we can spay them at any time, but because this is a procedure we're choosing to do, and it is a big operation, it's a full ovarian hysterectomy, what we want to do is do that when it's the safest time to do that possible. And that is when the blood supply to the whole uterus and ovaries is at its lowest. This usually occurs 3 months after they've finished their season. And this is a period called anestrus. This timing is really important because when they have their season and shortly afterwards, there are hormone changes that mean that their blood is less likely to clot. So we've got a very big uterus with an increased blood supply and blood that's less likely to clot, and we're doing major surgery. The reason everyone is really keen on doing it at the right time is we want to make it as safe as possible for each individual. The one thing we do usually ask is that you pop your female in to see us before she's due for her spay, so we can check her over, have a look. And this is also because some females will develop a phantom pregnancy after they've had a season. If this is the case, we need to wait for them to finish that phantom pregnancy. And some females will need some medication to help with that before we can spay them, because otherwise this can be something that is an ongoing issue with those female dogs. Right, let's have a look and see. I have got from Louise, does my dog need a vaccination every year? Well, again, this is something we get asked quite frequently. Great question. So the answer to this is yes, and it's not just because vets want to see your pet and give them a cuddle or want to make money. One of the important things that I think people don't always realize is when we vaccinate your animal, they're getting a full health check. Which is really important because our patients can't talk to us. It means that we can often pick up disease processes at a very early stage, and it means that they're much more treatable and we can do something about them. The other thing relating to this is that when we vaccinate dogs, we don't give them a full vaccination every year. So I'm not sure how aware people are of what we vaccinate for, but basic dog vaccines contain parvovirus, which I think most people are aware of. It's a really horrible virus. We still see it a lot in the UK. It has a very high death rate and it's highly contagious. It's often puppies that get this, which is why we always say don't take your puppy out walking until after it's had its vaccinations. We also vaccinate against distemper virus, which is really important. We've nearly eliminated it in this country, but there have been a few instances reported where people haven't been vaccinating, so it's very important that we continue with that. The other one is infectious canine hepatitis. Now, these three diseases, once dogs have had their primary vaccination course, so their 2 puppy injections and their booster a year later, their immunity levels actually last for 3 years. So we don't give dogs these vaccines every single year because they don't need it, and we don't want to be over vaccinating them and increasing risk for any adverse events. What we do need to vaccinate every year for, though, is a disease called leptospirosis. Now, leptospirosis is a very serious bacterial disease. It occurs across the whole of the UK, and it is a zoonotic disease, which means that it is a disease that can be passed from animals to humans. Lots of mammals can be affected by leptospirosis, so including humans, dogs, cats, foxes, rodents, pigs, horses, sheep. And in people, it causes something called Weil's disease, which is actually a notifiable disease and can, in some cases, cause life-threatening liver and kidney failure in people. So you can see this is something we really don't want to have in our houses or our homes. It's quite important not only for our animal health, but also for our health. In dogs, the symptoms can be very variable. It varies from very mild symptoms, so just a temperature, we probably may not even know that that's what it is, to actual life-threatening disease that can cause liver failure, kidney failure, and sometimes secondary blood clotting. The way this disease is transmitted is bacteria are shed in the urine of the carrier animals, so whether that be rats, foxes, anything like that. And they do like a quite moist environment, which means the UK is an ideal place for leptospirosis. Because of this, the BSAVA, which is the British Small Animal Veterinary Association, considers that leptospirosis is something that we call a core vaccine. So all animals should be fully vaccinated for this. With leptospirosis, unfortunately, immunity starts to drop quite rapidly after 12 months. So if animals don't have a booster every year, they won't retain the protective antibodies to help keep them safe and family members that they're living with safe from this disease. So yes, we do need to vaccinate every year, but we're not giving anything that your dog doesn't need. Right, let me just have a look and see. From Nikisha, I've got, hi Bridget, my guinea pigs are gaining a bit of weight. What would you suggest I do to prevent any more weight gain? So this is quite a good question. Piggies love their food, especially their treats. So obviously, guinea pigs are like rabbits. They need to eat and poo continually. If they stop eating or pooing, we have some serious issues. We get gut stasis, and this can be life-threatening in our small pets like this. So it is really important that they eat a huge ball of good quality hay, the same size of their whole body, every 24 hours. In terms of weight gain, the culprits with this are often the added treats we give them. Now, we know guinea pigs are quite different to other animals, apart from primates, in that they can't store vitamin C, so they have to have a dietary source of vitamin C. And all good guinea pig owners know they get this through their pellets that we feed them and through their fresh vegetables and greens that we give them. Unfortunately, some of the treats and the greens can be quite calorific for guinea pigs. Their metabolism is designed to work quite slowly, and survive literally living on grass. So if we start giving them a lot of quite sugary fruits, which they love, I know my pigs will do anything for a blueberry, but that is a massive treat for them. They get one blueberry maybe once a week, once every couple of weeks. And things like sweet corn as well, piggies love that. And they're often, the dried sweet corn are treats that can be sold in the pet shops. But again, those are quite calorific. So it's the equivalent of having a nice hefty slice of cake every day. I think to help lose weight, make sure you get really nice hay. There are some fantastic companies who will deliver hay to your house, and it smells nice enough to eat. I know I do that. It's also no plastic packaging, which is better for the environment. And the other thing that I try and do is get them to exercise a lot. Piggies are such social creatures. We are quite fortunate. Ours are very tame and can have the run of the garden, and will run around and play in the garden along with the dog and the cat. This is obviously not a good idea if your pigs are not that friendly, but let them have a really good run around, give them some tubes and boxes to run through and explore, things to climb up and down. They just love mooching around and having a look to see. They're very, very inquisitive creatures. So it's kind of a combination of increasing exercise and reducing calories. Let's have a look and see. Where else are we? Brilliant. Just have another look here. I'm just scanning through the questions quickly because I think we have one more time for one more question. That is fantastic. So I have got from Sarah, my cat keeps eating grass. Is this normal and why? So cats and dogs eating grass. Often we will see animals eating grass. This can be a slight problem, particularly in dogs, in that when they eat grass, they can actually eat some small slugs and snails, and this can increase their risk of developing or picking up lungworm, which is the only parasitic disease in the UK which is potentially fatal. So if you have a dog, and I know that Sarah was asking about cats, but if your dog regularly eats grass, it's a very good idea to speak to your vet and ensure that whatever parasite protection program you're on, you have good monthly cover for lungworm, so your dog isn't at risk. Cats and dogs tend to eat grass, often if they're feeling slightly nauseous or sicky. Often we will find that they eat grass and then vomit afterwards. Occasionally, this is something that dogs will do and cats will do, but I think if it's something that's happening regularly, especially if you're finding that there are bits of grass blades being vomited up in some bile, it may be worth checking with your vet, because sometimes with cats there are underlying conditions that cause sort of up-down nausea with them. And obviously when our patients can't tell us that they feel sick, it's dependent on us having a look and seeing if we notice things like that. So I would probably say if it's something that you're noticing on a very regular basis, then pop your cat in, get your vet to have a full check over. Often some blood tests are required just to check the internal organs like the liver, the kidneys, the pancreas. But it can also be things like dietary sensitivities, or if your pet hasn't been treated for worms recently, that might be another thing that could be causing an issue. So stop in and get your cat checked by your vet. Right, let's see if we've got anything else. Oh, right, I have got, we have got an incredibly talented cat here. I've got from Teresa Fisher. Hi, Bridget. Any idea how to stop my cat raiding cupboards? I've put child locks on, but he can open them. He always eats my rich tea biscuits and closes the door when he's finished. Teresa, I am wondering if that is maybe your child or your husband. It would be a good idea to get your cat weighed. If the weight is stable, I'd suggest looking for another culprit. Um, on a more serious note, if you do notice a sudden change in appetite in either your cat or your dog, whether that's an increase or a decrease in appetite, it is quite important to get that checked with your vet, regardless of whether there's a change in weight, because these things can sometimes indicate an underlying hormonal problem. And the sooner we pick that up, the better. Right, let's have a look. I think we've got... Oh, Carly has asked, hi Bridget, I have a 12-year-old cat who seems a bit stiff on his back legs. What would you suggest? Right, fantastic question from Carly. So one of the things that we're very aware of in our canine patients, all our dogs, because we take them out for walks regularly, is when they start slowing down and getting a bit stiff, it's quite noticeable. With cats, osteoarthritis is a huge problem, and there are up to 50% of cats over the age of 6 have evidence of arthritis in some of their joints if we do x-rays on them. But very few of these cats are actually brought to the vet so that we can do something about it. The reason for this is cats live the best life. All they do if they're a bit sore or stiff is they tend to slightly modify their behavior. So they will sleep for 21 hours a day instead of 20 hours a day. And they will tend to just not jump quite as high and rest on slightly lower surfaces. Now, it does make it a bit harder as an owner to pick up when there's a problem there. But if you take your cat to the vet, or if you suspect there is a problem, there is a lot we can do for these cats. The big problem with arthritis is because it's a painful condition, we can't cure it. It's degenerative. If there was a cure, humans would be using it. But what we can do is we can significantly improve the animal's quality of life by ensuring that we're giving them proper pain relief so that they're not constantly uncomfortable. There are lots of very good options available for cats. We have a really exciting new monthly injectable called Silencia, which is available for cats. And the nice thing with this is it has very, very little, if any, side effects. So it doesn't put any additional strain on other organs like the liver and kidneys in our older patients that are likely to have other diseases alongside. If monthly injections aren't an option, there are liquids available, liquid anti-inflammatories, as well as anti-inflammatory tablets. If these are used, though, we do need to monitor these patients quite carefully, and they will need to have regular blood tests. But most of these medications are specifically formulated for cats and are very tasty. So I know my cat, who is quite greedy, will actually eat the tablets straight out of his empty food bowl. For the anti-inflammatories, when he's pulled a muscle, he's had those in the past and they've worked very, very well for him. But I think the best thing with any animal where you're noticing ongoing stiffness or lameness or reluctance to walk as much as usual would be to take them to your vet, get them checked, and then we can prescribe the appropriate medication if there is an underlying problem. So I think, looking at our timing, I will have a look. Oh, so I've got another one. How do I know if my dog is a healthy weight? So very lastly, I am going to cover this one. And this is a lovely one because obesity in pets is actually a huge, huge issue and something that massively increases the risk of other disease. So lots of people aren't aware, but cats can get type 2 diabetes and all sorts of other cardiac disease, liver disease, arthritis, certain cancers. All of the incidence of these diseases are increased if your animal is overweight. So best thing to do with any animal is not obsess about the number on the scale. although that's really easy to do. The best thing to do is do something called a condition score. Now, if you have a look, there are very good dog and cat condition score charts that are available online, or even better, go in and see your vet nurse in your local practice, who will be amazingly helpful. But what we want to do is put our hands on the side of our dog's chest and be able to feel ribs directly underneath the skin. We shouldn't be poking through several layers of padding to feel those ribs. They should be just underneath there. Behind the rib cage, we should have a nice little little tuck where we see the go into the waistline. And when we're looking at the dog's side on, the point of the chest should be the lowest, and then we should go up to the back legs. I think, like I say, if you're unsure, vet nurse consults are incredibly helpful. Nurses are amazing. I can't tell you how much they're angels in disguise. They will sit and help you and talk to you for hours and let you know if there's any problems or anything that they can help you with. But I think if you want a quick guide, search up body condition score charts. There are two. One runs from 1 to 9, the other runs from 1 to 5. And if you look at the WSAVA, they will have approved ones, so the World Small Animal Veterinary Association. Fantastic. So I think that is all we have time for today. This has been a great session. Thank you so much, everyone. And if there are a few more questions, I will attempt to answer them by the end of today. Thanks and goodbye.